Now let's do types of muscle fibers. Okay? As much as you look at the muscle and they all look the same to you, they're orangey or red, obviously, if it's a real live specimen right here. There are different types of muscles, and we're going to give two of those types. The fast twitch muscle fibers, which are anaerobic or doesn't need much oxygen, okay, as its source of ATP. It has explosive power, but it fatigues easily. Okay. On the other side, right here, we have the slow twitch muscle fiber. It is aerobic, meaning it utilizes oxygen. Aero, think of air, oxygen. Okay? It has steady power and it has endurance. Much like the exercises shown in this image. This is short duration, just a few seconds before they can do that heavy lifting. This one could be, you know, this could be in a marathon. Okay? This could be for several minutes to hours. Okay? Here is the cross section of the muscle under a microscope. And these are all muscles, but you could clearly see the difference with the staining property. It shows you different types of muscles. So the first type of muscle fiber is for strength. It's lighter in color, as the picture shows you. It has less mitochondria, no red pigment myoglobin, because it has fewer blood vessels. The opposite is true of your slow twitch. Okay? They're darker in color. You can see that from the picture. They have a lot of mitochondria, which we know as the powerhouse of the cell, right? And it has the pigment that's present in blood. That's why it's dark in color. It's well fed. There are many blood vessels. So let's review some principles of muscle mechanics. Do muscles shorten when they contract? What do you think? I have been demonstrating biceps earlier. Do they contract? Or do they shorten when they contract? They do, right? But not all the time because there are different types of exercises. Okay? So some contractions may shorten muscles and some may not. I have here a couple examples of contraction. Isometric and isotonic. Okay? So let's look at the first one. Isometric contraction is when the muscle tension increases but does not exceed the load, and the muscle length will not change. Okay? Same measurement, same length, and yet it's contracting. Isotonic, so that's isometric. Isotonic contraction is when the muscle tension increases more than the load, the muscle length is changing. This is the one when the muscle shortens. Isotonic. Okay. Let's try to understand that better by looking at the exercises. So isotonic, your muscles are shortening, your muscles are changing in length. The exercises for isotonic contraction are your dynamic moving exercise. Like this, right? Like this. Biceps are shortening. This is dynamic. It's a moving exercise. Like rowing, like running. These exercises will shorten your muscles. Isotonic. Isometric, they're the stationary. Okay? Here's an example of isometric exercise. Like this. Okay? I'm exercising. I'm contracting my muscle. Right? Squatting. But nothing is shortening. Okay? That is isometric. Okay? So a good exercise would be a combination of isometric and isotonic. Okay? So, for example, your bicep curl, this one, Star Lord right there, great flex. What type of exercise is this? Which ISO is this? ISO tonic. Okay? But then, if he just holds it and tenses his muscle with that heavy dumbbell, oh, it's not a dumbbell, it's a beer bottle, right? It's still contracting, but what type of contraction is that? Isometric. No? Sometimes you will do exercises like this, isotonic, but then your yoga instructor or Zumba instructor will say, hold it there, hold it for a good 1 minute, you're still contracting, and that is isometric. So again, the best exercise would be a combination of both. Speaking of exercise, we have here the benefits of exercise, which we have mentioned in earlier chapter, whether it's skin or joints or bones, right? So increases strength, endurance, flexibility. It increases also your cardiorespiratory endurance, your heart and your lungs. The good cholesterol. HDL is good cholesterol. When you exercise, you will increase your good cholesterol, which is good for your heart. Okay. When you exercise, you'll have more protein than fat. Okay. When you exercise, you will also become less prone to cancers. Okay. Colon, breast, cervical, uterine, and ovarian cancers. Lack of exercise is known as a risk factor. As we know from skeletal system, exercise improves the density of your bones, which means less likely osteoporosis. And finally, exercise enhances mood and may relieve depression. Okay. Okay. Now we had a picture of a weightlifter there earlier. Okay. As you know, athletes, and not just the weightlifters, sometimes take anabolic steroids to grow their muscles, right? So these steroids are a group of substances that increase protein production. Muscle is protein, but they have a lot of side effects, from high blood pressure to cancer to impotence. Okay? But research also shows that individuals that use anabolic steroids have an increased aggressiveness and violent mood swings. So I ask you, are they worth the risk, should they be legal to use in athletics? Any idea? Yes. You said no. Well, we all know that steroids are banned in athletics, right? So that's for one thing. Okay? Um, and just looking at the information I gave you, this, is it worth the risk? I guess it depends on individual. Like some people don't care as long as they get the medal or the trophy for that. But really, with all those side effects, it's really not. In fact, if you were in a nutrition class, you know that you will get enough protein. You will get enough protein from just a regular diet without even supplements, let alone all the steroids. Okay, we're not in a nutrition chapter yet, but just showing you that steroids are bad. Okay. And now we go back to our abnormalities. Okay, we talked about a sprain earlier, which is basically twisting of a joint, forceful twitching of a joint. Strain, it's just a difference in letter. Sprain with a P and strain with a T. Strain is the injury is on the muscle. So you tore a muscle, that's a sprain. That's a strain, not a sprain. Many people often interchange these two, but they're very different from each other. Okay, let's see the difference in the symptoms and the consequences. So I have here a picture of I have there a picture, well, I don't remember what's on the picture. A picture of a normal ankle with all the ligaments that connect the bones. And then the second picture was the image of a torn ligament. just have to do it again. Sorry, very sensitive. We only have a few slides left, guys. There you go. Okay. So how do we treat, or what? At least what is the first aid for a sprain? We have the abbreviation RISE. If you're an athlete, you probably have heard of this. R is rest, I for ice. That's for the pain. Okay. C is compression. So we avoid pooling of fluids and swelling. And then E is elevation, again, to prevent the pooling of fluids down there that causes the swelling. Okay. Um, Another disorder, muscular dystrophy. Have you ever heard of this? Who comes to mind when we hear of muscular dystrophy? Or what comes to mind? My other classmate. What classmate? Who else? What about celebrities? Stephen Hawking. Well, we'll see a picture of him in a while. So, muscular dystrophy is a group of genetic disorders where muscles progressively degenerate and weaken, gets weaker and weaker by the day. Um, so here is an example of one of the MDs. This is Duchenne's muscular dystrophy. You'll see that in the next page right there. Okay, it's the most common of the MDs, and it's severe. It's inherited. It's sex-linked, meaning it's carried by the female or the female biological parent, but only the males, the male offsprings, are going to exhibit the disease. Okay, so if you have a male with MDs, the male got the gene from the mother, biological mother. Okay, so you could see here a child trying to walk up his knees just to stand up. Okay, this is a typical feature of Duchenne's. I think I have a GIF right there. Yeah? So a child with very weak, atrophied. Atrophy means the muscle shrank. And just to stand up, he needs to walk up um, his legs and his thighs. Okay? That's Duchenne's. Okay? Now, victims die, so they become clumsy. They usually die of respiratory failure in the 20s. That's because the respiratory muscles will eventually be affected by the weakness. So initially, it will be weakness of your muscles in your extremities, but it will also result to, it will lead to the weakness of your respiratory muscles later on. And then we have another one, muscular dystrophy. This is your ALS, amyotrophic lateral sclerosis. This is who I was talking about earlier, Stephen Hawking. The disease is also known as Lou Gehrig, so another famous person in history affected by it. Just the same, the neurons degenerate and die. No longer control voluntary muscle movement. Okay? So you see them in wheelchairs and all those machines because they can't walk, they can't talk, they can't move their hands at all. They use their lips to control the robot, to speak, type, etc. So I mentioned atrophy earlier. Okay? Atrophy is when the muscles stop growing. Basically, they shrink. Atrophy means lack of growth. They shrink because you do not. If you don't use it, basically this is you don't use it, you lose it. And you see them a lot in people who are in wheelchairs. Right? They're bulky on their upper torso, but they have atrophy in their lower. Or even if someone is in bed and hospitalized for weeks, their muscles atrophy. Astronauts, if they don't exercise up there in space against resistance because there's no gravity, they will also have muscle atrophy. Oops. Okay, so muscle strength declines 5% per day. So a lot of our muscles atrophied during COVID, right? We were much on our couches watching Netflix. Because without nervous stimulation, muscles will atrophy to one-fourth its size. Okay? They may even change into a different type of tissue. And if they do, like if muscle cannot go back to muscle anymore, you cannot grow them back anymore, they will turn into scar tissue. And if they already turn into scar tissue, rehabilitation is impossible. You cannot rehabilitate or train scar tissue because it's scar tissue. It's no longer muscle. Any questions on muscles? Let me just turn this off.